We'll be doing the cranial nerve assessment. So first, I will introduce myself. My name is Kevin, and we will be doing the cranial nerve assessment today. So the first cranial nerve is the olfactory nerve, but for this video, we're not gonna perform that. But to elicit that or to check that nerve, we'll ask the patient to close their eyes, and using a familiar scent, we'll ask them to identify what that scent is. And then for cranial nerve number 2, which is the optic nerve, which is responsible for visual acuity and visual fields, we will be using a Snellen chart. Okay, so for this test, we're supposed to stand 20 feet away from the patient, but due to limited space, we will just be pretending that it's 20 feet. So we'll ask the patient to read. Okay.
E F P T O Z L P E D P E C F T E D F C Z P F A L O P Z B.
Okay, one important thing that I forgot to mention is that if the patient uses a eyeglass, make sure that he wears them prior to the test. And then the second test will be the test of visual field. So I will ask the patient to, using her finger, point to me which finger moves using the 6 cardinal fields of gaze. Okay, ma'am, can you point to me which finger moves? Okay. Okay. Okay, so that is the test of a visual field. And another thing that we test for the optic nerve is the reaction to light. So I'm gonna, using a pen light, I'm gonna test for pupillary constriction. Okay, so pupils are reactive to light. And then we'll proceed with optic nerve number 3, 4, and 6, which are responsible for eye movement. So cranial nerve number 3 responsible for accommodation. So I will ask the patient to look at my finger and follow the finger as it moves closer to her. Okay, so as my finger moves, we can expect that the eyeballs go close to each other. And then for cranial nerves number 4 and 6, which are responsible for oblique and lateral movement, I'll ask the patient again to follow my fingers. Okay. And then downward. And then the lateral. Okay, so those are the tests for optic nerves number 3, 4, and 6. Now we'll proceed with cranial nerve number 5, which is the trigeminal nerve. It has 2 parts, the motor part, which is responsible for chewing. So we'll palpate the masseter muscle, and we'll ask the patient to clench her jaw or move her mandible. Okay, so we can feel the contraction. And then for the sensory part of it, we'll, using a cotton ball, we'll ask the patient to close her eyes, and then ask her to tell us if she feels the cotton ball when it's being touched.
Yeah. Yep. 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 Yep.
Okay, so that is cranial nerve number 5. So cranial nerve number 7, which is the facial nerve, we'll ask the patient to close her eyes, close your eyes, and close them tightly, squeeze them tightly, and then smile, frown, and puff your cheeks. So that is the cranial nerve number 7. So for cranial nerve number 8, which is the vestibulocochlear, which is responsible for hearing and balance, so we'll test the hearing acuity. So occluding one ear, I will ask the patient to repeat to me what I will be whispering. This is the whisper test. Okay. 77.
77.
That's too loud.
Purple.
Okay, so she was able to repeat to me what I whispered. And then for this cranial nerve, we'll also be doing the Rhine's test and Weber's test. So for Ryan's test, this is elicited by tapping the tuning fork and placing it behind the mastoid bone, and we'll ask the patient to tell us when he doesn't hear it anymore.
Okay.
And then we put that in front of the ear. So usually ear conduction is longer than bone conduction. And then we do the Weber's test. So again, we tap the tuning fork, place it in the middle of the forehead, and we'll ask the patient if she hears the vibration on both ears or on just one ear.
I hear it in both ears.
Okay, so that means a normal Weber's test. Okay, so for we proceed with cranial nerve number 9, which is the glossopharyngeal. We'll test that together with cranial nerve number 10 and number 12. So for we'll use an improvised tongue depressor. For cranial nerve number 9, glossopharyngeal, we'll ask the patient to stick her tongue out and open your mouth wide open. Stick your tongue out, and we'll press the posterior part of the tongue so that we can elicit the gag. Okay, so we were able to test cranial nerve number 9 by eliciting the gag reflex. And then for cranial nerve number 10, we can check that by asking the patient to swallow. And we also check that when the patient was able to talk to us without hoarseness. And then for cranial nerve number 11, which is the accessory nerve, it's responsible for the trapezius and the sternocleidomastoid muscles. So we'll ask the patient, so I will put my hand on her face and ask the patient to go against my resistance. Okay, and we'll do that on the other side. And then we'll ask the patient to shrug her shoulders against my resistance. Okay. And then for the last cranial nerve, which is the hypoglossal nerve, cranial nerve number 12, we can check that by asking the patient to stick her tongue out and move side to side. Okay, so that ends the assessment for cranial nerves. Thank you.